Fertility challenges don't look the same in everyone. Conditions like polycystic ovary syndrome, endometriosis, fibroids, fallopian tube blockage, and male factor infertility can present differently. Here's how we treat them. So PCOS is a condition where oftentimes women aren't ovulating or they're not ovulating normally. If that's the case, then we manage that. We get them to ovulate with medications, and that can help improve their chances of success. It may not be the only thing that's needed, but that's often part of their treatment strategy. In addition, women with PCOS may have some other comorbidities, in other words, other medical conditions that we want to screen for. Prediabetes or diabetes is often found alongside. They may have polyps, which are overgrowths of the uterine lining. So those are things that we want to screen for and make sure they're also not contributing to their infertility. Endometriosis is another condition that's often found in couples who are struggling with infertility. Up to 50% of women who have infertility may also have endometriosis, and doing surgery on everybody to diagnose infertility may actually not be a good risk-benefit ratio. So we don't do that for everybody, knowing that it's so common and so many people still get pregnant without the diagnosis being confirmed. Uterine fibroids are a common problem. We see them in more than 50% of women, but we don't always need to manage the fibroids. It depends on where they're located and how large they are and whether or not the woman has had any reproductive consequence from the fibroids. Another common thing we see with couples who are struggling with infertility is blocked fallopian tubes. Increasingly, we're moving to IVF instead of surgical correction of fallopian tubes because success rates are so much better with in vitro rather than trying to correct and reanastomose or connect the fallopian tubes. Male factor infertility, again, affects up to 50% of couples, often overlooked, but a very important part of our treatment. Depends on how severe the male factor infertility is. Sometimes we bypass it with intrauterine insemination. Sometimes we require in vitro fertilization. And sometimes we might need to work alongside the urologist to look at more advanced treatments like testicular sperm extraction. Those are things that we work with the urologist for their guidance. The main take-home point is that you may have more than one factor involved, and it's important to do a thorough evaluation and not focus in on just one problem necessarily. At OC Fertility, we're here to do just that because there's a path forward, and we're here to help you grow your family together.